Over the years, I've had people ask me, why are you so passionate about biological dentistry? And so I tell them my story. This is how I got involved. I had a patient in 1992. Her name, well, you don't need to know her name. Let's just say her name was Susan. Susan had been my patient for many years, and she had a lot of decay in her mouth. I filled a lot of her cavities with a mercury amalgam filling. As a matter of fact, at that point I had probably put in about 18 fillings in her mouth. Coincidentally, Susan was also being treated by my husband, who was a chiropractor. She was being treated by my husband because she had chronic fatigue, and she believed that if she was well adjusted and had good nutrition, her chronic fatigue might get better. So she was being treated by my husband and myself. Now, some of you might see the circumstances there is a little funny. I'm making her sicker, and my husband's trying to make her better. Wasn't funny to Susan, probably. Anyway, one day Susan comes into the office and gives me an article to read and asked me if I would be open-minded about it. I agreed. I said, sure. The article was written by Dr. Sandra Denton, who was a medical doctor working for Dr. Hal Huggins in Colorado Springs. At that time, there was a center in Colorado Springs called the Huggins Diagnostic Center, and she worked there. The article was written about mercury and its effect on the body. So I was open-minded. I read the article. I was blown away. I couldn't believe what I was reading. The article was talking about how mercury affects every part of the body, how it affects your brain, how it affects the way you think, how it affects the way you function. It affects your digestive system. It affects your muscles. Mercury affects everything. Well, part of me didn't want to believe this. I was told in dental school that mercury did not leave the filling after the filling was placed in the mouth. So this was saying something totally different to me. I took the article to the local hospital library. We have a very fine library in Scranton, and doctors are able to use that and do some research. I'd asked the librarian if she would just simply check this very long bibliography and see if these are real journals. I take pride in the fact that I'm a New Yorker. Nobody's going to pull the wool over my eyes. I wanted to make sure these were not bogus journals, because the Journal of Ionizing Chemistry was not one of my favorites. I didn't even know if it really existed. So I just wanted to know if these were bogus journals or real journals. She calls me up the next day and says, Dr. Grube, I have your articles for you. What articles? I didn't ask for any articles. I just wanted to know if they were bogus. She goes, well, I thought they were very interesting, and I thought you might like to look at them. Okay. She gives me a stack of journals, articles this thick. Every article was written either by a physiologist, neurochemist, physician, biochemist, psychiatrist, urologist, you name it. Every kind of scientific specialty there is had an article written about mercury and how it affects the body. Except there wasn't a single article written by a dentist. Not a one. Well, there was one last sentence in the back of the article that said, if you want further information about mercury toxicity, contact the Huggins Diagnostic Center. So I called them up. I said, hey, I want to learn about mercury toxicity. They said, well, if you want to learn about mercury toxicity, you've got to come out to Colorado. Whoa, now they've gone too far. I have 3 children, 2 cats, a husband, and a dental practice. I'm not going out to Colorado just to learn about mercury toxicity. Why can't you just send me a book? That's how naive I was at that time. I really didn't know what was involved. Well, they convinced me over the phone that I really did have to go out to Colorado and asked me, are you coming out on Continental or United? I guess I'm coming out. So I went out to Colorado. And in those days, Dr. Huggins used to take the blood of every dentist that walked into the room. Now I'm thinking, maybe I got myself involved in a cult. I've never taken a continuing education course where they took my blood before they did anything else. Well, I sat down, I gave him 2 vials of blood, and then I found myself a place in the classroom. For 3 days, Dr. Huggins talked about mercury, mercury, mercury. He taught us everything that mercury does to the body and how poisonous it is to us. On the 4th day, he announces that our blood test had come back from Colorado Springs General Hospital and that he was going to show us how mercury changes somebody's blood chemistry and how you can look at the blood chemistry and see just how toxic somebody is or how sick they are. Well, I thought, well, that's interesting. Well, my blood was one of the first ones to come back, and they put it on an overhead projector. Now, those of you who are too young to know, before we had PowerPoint presentations, we had overhead projectors. It was a fancy light. You would put the sheet of paper over the fancy light and shine whatever information you wanted on a huge screen. So my blood chemistry results went on a huge screen about 60 feet wide and about 25 feet high. Dr. Huggins looks at the blood and says, "Ooh, we got a sick puppy here. Whose blood is this?" Mine. He said, "So Blanche, how long have you had cancer?" "Excuse me?" He said, "Well, they circled it in red." And they did. The hospital took a red magic marker and circled it in red, 1% metablastic cells. And I said, "Well, it says only 1%. That's not a big number." He answered me, "You're right. 1% you're sick, 2% you're in the hospital, and 3% you're dead." This sounds serious now. Then he asked me a very unusual question. Now remember, we've been studying mercury for 3 days. No mention about root canals. But he asked me, "So Blanche, just how many root canals do you have in your head?" I just met this man. We've been talking about mercury, and now he's asking me how many root canals I have. How does he know I have root canals? So I told him, "I have 5. Almost as if I was proud of it. He said, "Good, you're going to get them taken out, aren't you?" I'm still a New Yorker. I said, "Hell no. Why would I get them taken out? I'm very proud of the fact that I have 32 teeth, and I plan on going to my grave with 32 teeth." And he looked at me and he said, "That's exactly what you're doing." Gave it a lot of thought. I think he was right. I was going to my grave with 32 teeth. It took me quite a while to understand everything about root canals and why they were not good to have. And I understand and I sympathize with patients who don't want to have their teeth extracted. But in my case, I had to have my teeth extracted. I no longer wanted to have cancer. I still had 3 children to raise. So it took a few months. I know it sounds like I put myself in an institution, but I signed myself up in the Huggins Diagnostic Center as a patient. I had 18 fillings removed and 5 root canal teeth taken out. My brain fog disappeared overnight. That is an incredible event because I didn't even know I had brain fog. I thought I was just normal. This was just the way I was. I would walk into a bathroom and forget what I was there for. I could never read a sentence without going back to the beginning. I certainly couldn't read a paragraph and have any comprehension of what I said. As a matter of fact, in 3rd grade, I was put in remedial reading because I couldn't read. I stayed in remedial reading all the way through high school. I decided to become a music major. I was going to be a music teacher because musicians don't do that much reading. Everything they see, they pretty much have seen before. They've already practiced it several times. So I was going to be a music major, and I stayed in music. So in college, I was a music major, and even then, I took the Evelyn Wood reading course. I took it twice, not once, but twice. The Evelyn Wood reading course taught you to follow your finger, and as you moved your finger faster and faster down the paragraph, you would pick up your speed. Well, that was fine. I was really good at moving my finger. It was just that I had no comprehension when I got to the bottom of the paragraph. Then, to make a very long story short, I did change my major and decided to go into dentistry. Another dentist had convinced me that dentists really don't do that much reading. They memorize a lot of stuff, but they don't do that much reading. So I was safe again. I could get through dental school. I could memorize things, but I couldn't read. Which was kind of sad because my father had a small publishing business and owned a bookstore. So reading books was very important in our family, but I couldn't do it. Anyway, after I had my fillings removed, my brain fog disappeared. I woke up one morning, it was as if my IQ had gone up 20 points. Suddenly I had a clarity in my brain, I had a silence that I could hear that I had never experienced since the time I was 4 years old. I was 4 years old when my first amalgam mercury filling was placed. Suddenly I could read again. I grabbed a magazine, I quickly did my Evelyn Wood finger moving thing and said, "Aha, I got it. I can read." I was so excited. I couldn't wait for the clinic to open. I couldn't wait to see Dr. Huggins and tell him how grateful I was, because even if my cancer didn't go away, I was going to spend the last 2 months of my life reading. He looked at me and chuckled and said, "Oh, come on. You'll do just fine, Blanche. You'll do fine." Well, my metablastic cells disappeared 3.5 weeks later. I would test my blood every month because I wanted to make sure I was okay. Then I would test my blood every 3 months. Then maybe every 6 months. Now I test my blood maybe once a year. I've been checking my blood every year since then. I have Dr. Hal Huggins to thank for that. I no longer have leukemia, and I became really interested in root canals and their effect on the body. I began to research root canals. And when I discovered after 10 years of researching root canals and testing root canal teeth that had been extracted, testing root canal teeth that hadn't been extracted, the conclusion that I came to is that there is no such thing as a non-infected root canal. All root canals are infected. I'll say it again. All root canals are infected. It's a chronic infection in the body. You may be able to handle it. You may not. I know some people who actually smoke cigarettes, 2 packs a day, and drink alcohol. And some people actually do live to be maybe 80, 85. There are few people on the planet that can do that. I'm not one of them. If I have 1 glass of wine, Blanche is very happy. If I have 2 glasses of wine, Blanche is either under the table or making a fool of herself. I can't handle it, and I feel it the next day when I wake up if I did have 2 glasses of wine the night before. Some of us are more sensitive than others. Root canals are not for everybody. Yes, there may be 1 or 2 people out there that can handle a chronic infection. It's your choice. You need to understand exactly what a root canal is and what it does to the body. Then it's your choice to decide what you want to do with your white blood cells. Do you want to spend your immune system fighting an infection that you can never cure? Or do you want to save your immune system for something important that comes down the pike, like cancer, like hepatitis, like AIDS? It's your choice. So now you understand why I get so passionate about biological dentistry. I encourage you to watch the rest of the videos in this series and try to have an understanding, a better understanding about dentistry. The more you understand about dentistry, the better the decisions you make will be for your health. It's not for everybody. Biological dentistry is only for people who are really concerned about their health.